name is Gretchen Jimenez. I'm a student physical therapist. Is it okay if I work with you today? Alright, awesome. So today I'm just going to be listening to some of your heart and lung sounds. And for this, I'm going to have to ask you to take off your shirt. Is that alright with you? Okay, awesome. So we're going to start off by listening to your lung sound. And so with listening to your lung sounds, I'm going to have you take some nice, easy, deep breaths in and out through your mouth, okay? And then I'm also going to be feeling for some structures on the front and on your back eventually. Is that all right with you? Okay, awesome. So I'm going to go ahead and remove your bra strap. Is that okay? So I'm going to feel for her clavicle and then come superior. Go ahead and take a deep breath for me. Good. And then same thing, clavicle, come superior. Go ahead and take a deep breath. Good. So those are her right and left upper lobes, anterior apical segments. Now I'm going to feel for her angle of Louis, which articulates with the second rib. Come to the mid-clavicular. Go to the second intercostal space. Go ahead and take a deep breath. Good. Then I'm going to go do the same thing on the other side. Find the angle of Louis, which articulates with the second rib, mid-clavicular, second intercostal space. Go ahead and take a deep breath. Good. So those are her right and left upper lobe, anterior segments. I'm now going to ask you if you can go ahead and lift up your breast tissue as well as the underneath side of your bra. I'm going to be feeling for her xiphoid and then coming up superior and lateral to the intercostal space. Can you go ahead and lift your hand up just a little bit? Thank you. Go ahead and take a deep breath. Good. And so that was her right middle lobe. Same thing on the other side. Superior and lateral to the xiphoid, finding the intercostal space. Go ahead and take a deep breath. Good. And that's the left lingula. Now, I'm going to go ahead and find her xiphoid again, level of the xiphoid, mid-clavicular line, and then mid-axillary line. And then I'm going to go in between the mid-clavicular and mid-axillary line in the middle. Is it all right if I raise this up? And then find the intercostal space. And then go ahead and take a deep breath for me. Good. Okay. And then same thing on the other side. Finding her xiphoid, mid-clavicular, mid-axillary, coming in between the two in the middle. Finding the intercostal space. Go ahead and take a deep breath. Good. Okay. And so those were her right and left lower lobes, anterior basal segments. I'm now going to listen to some lung sounds on your back. So can you go ahead and turn around, and it'll be the exact same process, okay? So I'm going to go ahead and move your bra strap. And we'll be listening over the upper tracts. Go ahead and take a deep breath. Good. And then same thing on the other side. Go ahead and take a deep breath. Good. And so those were her right and left upper lobe, posterior apical segment. And then I'm going to find the spine of the scapula. Come in medially. Find the intercostal space. Go ahead and take a deep breath. Good. And we're going to do the same thing on the other side. Find the spine of the scapula. Come medially. Find the intercostal space. Go ahead and take a deep breath. Good. And so those are her right and left upper lobes, posterior segments. I'm now going to find the inferior angle of the scapula. Then the spine of her scapula, come find the middle of it, of the two, find the intercostal space. Go ahead and take a deep breath. Good. Same thing on the other side, inferior angle, spine of the scapula, find the middle, intercostal space. Go ahead and take a deep breath. Good. So those are her right and left lower lobes, and that is the superior segments. Then I'm going to find the inferior angle of her scapula, and I'm going to come at the level of the inferior angle, come medially, find the intercostal space. Go ahead and take a deep breath. Good. Same thing on the other side, find the inferior angle, find the intercostal space. Go ahead and take a deep breath. Good. So those are her right and left lower lobe, posterior basal segments. Then I'm going to find the inferior angle of her scapula. I'm going to come inferiorly and laterally. Is it alright if I lift up the bottom edge of your bra? And then I'm going to find the intercostal space. Go ahead and take a deep breath. Good. And then same thing on the other side, finding her inferior angle, going distally and laterally, finding the intercostal space, and then go ahead and take a deep breath. Good. All right. So those were her right and left lower lobes, lateral basal segments. I'm going to have you go ahead and turn around for me. And this time we're going to be listening to your heart sounds. I'm going to start off by listening with this part of my stethoscope and then this side. And then you can just go ahead and relax. I don't need to worry about your breathing or anything, okay? So just be nice and relaxed. So we're going to start with the aortic area where the aortic valve is. Find her angle of Louis. Come laterally to the second rib. Find the second intercostal. And then okay. And then we're going to the pulmonary area, which contains the pulmonary valve, finding her angle of Louis, where it articulates with the second rib, finding the second intercostal space. And then for this next one, I'm going to ask you to go ahead and lift up your left breast tissue as well as the bottom edge of your bra. And then for tricuspid area, I'm going to start by palpating for the xyphosternal junction, which articulates with the 7th rib, and then finding the 6th rib, and then the 5th rib, and finding the 5th intercostal space, and this one is just lateral to the sternum. And then the mitral area is at the 5th rib as well, and mid-clavicular. At the 5th intercostal space. You can go ahead and relax. And that was the mitral valve. Now I'm going to go ahead and switch to the bell, and we're going to be doing the exact same thing. So, palpate for the xyphosternal, 2nd rib, 2nd intercostal space. That's the aortic area, and then xyphosternal, 2nd rib, 2nd intercostal space. Okay, and then can you go ahead and lift up your left breast tissue again? Again, xyphosternal articulates with the cartilage of the 7th rib, finding rib 6, rib 5, and this is just lateral to the sternum. Good. And then the last one, it's mid-clavicular, and this is the mitral area. And that is all I have for you today. Thank you for working with me.